Good day, and welcome to our COVID-19 discussion. I am Lieutenant Colonel Scott Hawks, the State Public Affairs Officer, and I am joined by Colonel Luhman, our State Surgeon. We're here to talk about a few questions that have been brought up by our force and to be able to hopefully bring you some answers that may give you relief and give you more information and prepare you for the potential of taking the COVID-19 vaccine. There's been a lot of word about the COVID-19 vaccine as of late. One of the questions is, when will it be available? When is it going to be available to us?
Well, the Minnesota Army National Guard, or National Guard, including the Air Force, has already received approximately 2,500 doses. And we've already started vaccinating the force. And we started vaccinating the force based on priorities that were originally established not only by the CDC, but then the Department of Defense and the Army National Guard. And we took those cues to prioritize our soldiers and airmen in the state. And obviously we started with those soldiers and airmen who are currently out there fighting the COVID fight, either supporting nursing homes or testing stations. We've already started those soldiers and airmen, and actually they're in the window now for their second dose. And then we'll move down the priority list to readiness units, folks who are deploying the MOBers, and move on down then just to the regular old everyday soldier we love that is an M-Day soldier drilling on the weekend. It's already happening right now.
There's a lot of fear and uncertainty about the vaccine. There's a lot of stories and facts and non-facts in the internet and social media. Is the vaccine safe?
So both of these vaccines that are available right now, both the Pfizer and the Moderna vaccine, have been approved by the Food and Drug Administration, the FDA, for emergency use authorization. All that simply means is that they've done the studies, they've done the research, the FDA has reviewed all that data for safety, and they said, yes, it is important that we get this vaccine out there now because people are dying. So are they safe? They are safe in the sense, yes, they are safe. And we've already had, I think it's over 20 million, if I could check my notes, I think it was 20 million Americans who've already received the vaccine. In fact, I was looking into this recently. For the Moderna vaccine, which is available to our soldiers and our airmen here in the Minnesota Guard, of the first 4,000, or correction, of the first 4 million doses that were given across the country, the CDC received report of side effects at a rate of 0.03%.
Wow.
So this Moderna vaccine has very few side effects. So it's safe for our soldiers, and I encourage all of our soldiers and airmen to take the first available opportunity to get the vaccine.
And the Moderna vaccine is the vaccine that we in the Minnesota National Guard have the opportunity to get as it becomes available.
Correct. We have the Moderna here in the National Guard. And then, of course, there's the Pfizer vaccine that the VA and other agencies across the state have available.
And both you and I, for clarity for everyone else out in the audience, you and I have both been vaccinated. You've been vaccinated through the VA.
Correct.
When your opportunity came up as a physician, and I was vaccinated as a firefighter when that opportunity came up for me. I had the Moderna, and you had?
I had the 2 doses of the Pfizer vaccine.
So the Pfizer. So we are 2 examples of people who have been vaccinated, and we're both still walking around and here today.
And we're here today.
So in the Army and in the Air Force, we get a lot of vaccines that we're just required to get. Is this one of those vaccines?
At this time, it is not required. It is optional for our soldiers and airmen because it is authorized under emergency use authorization. We cannot make it a required vaccine, so it is voluntary, yes.
Okay. So who should get the vaccine?
So the Moderna vaccine is available to anyone 18 years of age and older, and really it's anyone who 18 years and older who would like to get vaccinated, to take that opportunity to protect not only themselves, but their family and their fellow soldiers and airmen. All of those folks should get the vaccine. The folks who should not, or at least consider not getting the vaccine, the only category really is anyone who's had a serious adverse reaction, for example, anaphylaxis to a previous vaccine, or someone who is allergic to any of the contents of the vaccine. And you got to dig into the books to look and exactly see what's in there, but I can tell you that there's 3 things that are not in that vaccine, and one of those is a preservative, There's no latex, and the third I'm blanking on right now, but there's no latex, no preservative, and oh shoot, sorry, I'm blanking on the last of the third one there. Sorry.
But another one of those things that sometimes is questionable.
Yeah, you know the ones that you know, like the there have been concerns in the past that have been debunked about preservatives in vaccines. Well, thankfully, there's no preservative in this vaccine. There's no live virus in this vaccine. It's simply what they call the mRNA, or the messenger RNA, that tells our bodies to produce this little spike protein, which our bodies then recognize as foreign. We develop antibodies, and that's how these vaccines work.
So you're speaking about RNA. That's one of those questions that people have as well. There's the giant fear that it's going to change my DNA and affect my reproduction. What can you say about that?
Okay. Well, first thing I would say is that the mRNA in these vaccines does not interact with our body's DNA. That mRNA does not even get into the nucleus of any of our cells where our DNA resides. This mRNA, what it does, without going into too many details, but it tells certain cells in our body to create a protein, and this protein then duplicates those spike proteins that sit on top of the virus. And once that mRNA in our cells has done that job, guess what? It gets degraded and goes away.
Mm-hmm.
So it's not sitting around in our cells forever and a day. And it certainly, definitely does not interact, disturb, or rewrite our own DNA.
Excellent. That'll make a lot of people, I think, understand that process a little bit better. I know that's one of those fears that people have when they're not educated about something. So we educate. That's what we do. So I did notice that in your list of folks that shouldn't get the vaccine, you didn't say people who'd already had COVID-19. So would you recommend this vaccine for people who've had COVID-19?
Yes, the CDC is recommending that the folks who have suffered or already had and recovered from the COVID virus, they're recommending that those folks seriously consider getting the vaccine. There's no contraindication, or there's no reason why they should not get the vaccine. So yes, anyone who's ever had COVID should go ahead and get the vaccine as well. It's an added layer of protection.
Excellent.
Now they should wait until they've come out of their 14-day quarantine window. The only other people who should hold on getting the vaccine, and this is going to be very, very few people, but anyone who was sick enough to be in the hospital and then they get the convalescent antibody treatment, those folks it's recommended that they wait 90 days.
Well, even 3 months, 90 days, as you say, they're still getting the vaccine just a little bit later.
Yep.
If I happen to be one of those folks that has not a contraindication, but a negative reaction to the vaccine, does the Minnesota National Guard cover me if that happens?
Oh, that's a great question. So if the soldier or airman received the vaccine while they were in a duty status, and then they subsequently get some sort of adverse reaction or what have you, they need to report that to their chain of command. Obviously, if it's something serious, they want to get care for that. But they should report that to their chain of command. And if it meets the criteria for the initiation of a line of duty or an LOD, then yes, if they receive the vaccine while they're in a duty status, an LOD would be appropriate.
Excellent. Can I still get COVID-19 once I've had the vaccination?
That's a good question. It's possible. The reported effectiveness of these vaccines is somewhere in the range of 95%. So yes, it's still possible. And that's one of the things that the researchers are looking at right now. Now that we're out there vaccinating millions and millions of people, we're going to get more data on just how effective these things are. I mean, the reinfection rate has been amazingly low for this virus. So the answer to your question is yes, it's possible. A lot of things are possible. Is it probable? Probably not.
In the studies that they've put out, they said greater than 95% effective and some of those kinds of things. So that's really good for a vaccine. A lot of vaccines aren't quite that high.
I would take those odds.
So how is this vaccine administered? Is it different than another vaccine that we might have received?
No, it's much like the other ones. It's an injection that they call it intramuscular, or IM. So it's a needle. It's just like a flu vaccine. It goes right into the muscle, usually in one arm or the other, and it's administered in 2 doses that are typically going to be 3 to 4 weeks apart. So when a soldier goes in to get, or a soldier airman goes in to get their vaccine, their unit will also be scheduling for their second vaccine. And there's a couple other points to be made there too. I mean, your question was about the administration. Administration is just like any of the other shots that they're going to get. And granted, you know, I have an experience and of one person, but when I had the vaccine, it was just like the flu vaccine. Actually, it kind of went better than the flu vaccine. It didn't hurt at all. But everybody's experience is going to be a little bit different, but just think of it as the flu vaccine. And then the other thing I was going to say was that with regards to because remember, there's two different vaccines out there. We don't want to mix. As we sit here right now, they're still trying to figure out at echelons above us as to whether or not it would be okay if you've got the Moderna for the first one and then the Pfizer for the second one. Are you covered? The guidelines right now are stick with one or the other for both of the doses.
Well, and that's how it's approved through the FDA,
Right.
so it only makes sense that you follow the rules.
Yep.
And as you said, this is a two-part vaccination. How long after the first vaccination will the second vaccination be scheduled?
It's typically going to be a 3 to 4 week window.
Okay.
Yep.
And will that then coincide with drill in most cases?
It depends on the unit.
Okay.
It really depends on the unit and when they need their folks there. So I would just tell our soldiers and airmen out there to work with the chain of command in terms of scheduling for the vaccine.
Perfect. How long is this going to protect me from COVID-19?
It's a great question. We don't know at this point. That work is still ongoing. I think we'll find out more as the year moves on and as more people get vaccinated. So at this point, we don't know. There's some talk of getting an annual COVID vaccine, much like we do with the flu vaccine. And then there's others out there who are saying otherwise, that it may infer lifelong immunity. We don't know. I don't know. So we'll have to wait and see. But I can tell you this. I know it's better than getting nothing. I mean, thankfully, we have a vaccine. And that's why I was one of the first that I put up my hand, and thankfully, my employer said, hey, we got an opening today, come on in, and I did not hesitate.
What are some of the possible side effects that you could get from the vaccine?
Well, some of the possible side effects could be like with any other vaccine. You can get soreness or tenderness or redness or even swelling at the injection site. Some people will experience a fever. Some people have experienced what we call tachycardia, where your heart sorts of kind of races a little bit, and then upset stomach. It really parallels what you are told every year about what you may experience from the flu vaccine. There's always the potential for serious adverse reactions, and one of those that we really get concerned about, or it could be anaphylaxis. Anaphylaxis is when you have your body reacts abnormally to the vaccine, blood pressure drops, and sometimes you may need some medicine to raise the blood pressure. Good thing is, our folks are trained at every vaccination site that we have trained medical personnel that are ready and prepared to respond effectively and appropriately to any one of these potential adverse outcomes, which thankfully in the 1,250, 1,300 doses that we've administered so far, we have not seen.
Excellent. And then my last question for you. Even though I've had the vaccine, even though I've done that part, what do I need to do about social distancing and wearing a mask?
So even though you've had the vaccine, thank you for getting the vaccine, you still have to wear your mask and social distance and follow the guidelines that are currently in place. At some point down the road, we hope that will change, but for the time being, even though you've received the vaccine, you still have to mask, social distance, follow the current COVID guidelines, yes.
Thank you very much for being here with us, Colonel.
You're very welcome. Thanks for having me.
So bottom line, the COVID-19 vaccine is safe. It is not a requirement for you to get it. However, we strongly encourage you because it only helps us create a safe place for your friends, your family, and your other service members that you work with. As we continue down this road with COVID-19, as more people become vaccinated, hopefully restrictions will be able to be loosened up, and we'll find out more information. Thank you very much for tuning in today.